Well, to start with, I think we'd like to have an introduction of you for the video. So if you could provide an introduction, who you are, what your name is, what your title is, and anything else that would be important for us to know as an introduction of.
Okay. Well, great. Yeah, just a brief background of myself. I was born and raised in Wisconsin. My wife actually was born and raised in La Crosse, which is why we ended up here. I was a medical student at the University of Wisconsin and did my pediatric rotation here way back in the 1980s, which is one reason that I really decided to come back to Gunderson after much of my career had been in Virginia. So we decided to come back here to care for parents and be a bigger part of their lives. And I came back to be a family physician at Gunderson. Almost immediately when I came back, I had approached the head of medical education and said, we really need a family medicine residency. That was back in 2007. Dr. Chestnut, then the MEO director, had said, I think that's going to be on the burner. So I believe in about 2013, I was approached again to think about whether we could start a family medicine residency. So that's what brought me here. I've been a practicing family physician in a number of contexts throughout my life, both in rural health care, working in an academic center for 4 years, private practice for 15, and now with Gunderson for 12 years.
Can you say your name and your title and what you
do
here for
Sure.
Gunderson?
Yeah, my name is Paul Klas. I'm an MD physician, a family board-certified family practice physician, and my title is Program Director for the Family Medicine Residency here at Gunderson.
Very good, thank you. So Dr. Klas, what distinguishes the Gunderson program from other family medicine residency programs?
I think that there are a number of things that distinguish our program from other programs around the state and the region. First, I think, is just the high quality of education that all medical trainees get here. So that would be probably a single standing point. Gunderson here focuses on education, training both medical students, residents, and other physicians. It's just part of the heart and soul of our institution. So forming a family medicine residency was an easier thing because of that. We weren't trying to get people to teach who didn't teach already. And so that the heart and soul of Gunderson is to educate. And it is one of the things that makes us stronger. I think, and this has just occurred, we have really strong faculty, both in our residency and outside of the residency, and all of the really important disciplines such as orthopedics, internal medicine, our hospitalists, pediatrics, and obstetrics. All of the core foundation was already here before we even started the residency. Finally, I would say it's the quality of the residents we've been able to attract. From the get-go, we had just fantastic residents who were superior residents. I think they were attracted to what we were trying to do here. And so that's, I think, one of the biggest things has been the quality of the residents. I think that kind of captures it. So
wonderful. Thank you. Talk a little bit about the impact of the program up to this point. We haven't yet graduated a cohort or a class of residents, but what has the impact been for the organization?
The impact of the organization, I think, is pretty diffuse. I would first say that the impact on the organization as we graduate residents will be relatively substantial. We have 3 residents who are actually going to work in the Gunderson system. One is going to Viroqua to do full spectrum care, including obstetrics, Dr. White. Another resident is actually going to stay in the family medicine residency program to provide care and to help educate our residents. And another one is actually going to be in La Crescent, just across the river, being a full-time family physician. She's actually going to come back and teach inpatient medicine for our residents. So that's very very exciting for me to see someone who's been educated by us to come back and be part of our program. So that's the first thing. I think the other thing is that this is just so good for family medicine. To have a high quality residency in family medicine at an institution like Gunderson really helps advance family medicine in our institution. We're a pretty strong multi-specialty healthcare system. So I think having a really strong primary care residency is added to the institution, and it lets physicians who are specialists see the quality of family physicians that they're helping to train.
Great. Now talk about the same impact from the lens of the patient. Why would family practice and a training site at Gunderson be beneficial, and what is the impact to the patient and to the community?
I think that there are many impacts that our residency has had on patient care. It's been interesting to me that we have been able to attract a pretty broad demographic. Traditionally, residencies have been places where just really underserved people go, and we certainly care for a good number of underserved patients in our residency. People with severe psychiatric illness have found a home in our residency, which has also been good. But we've attracted a broad demographic from physicians, residents, people from all strata of La Crosse. So I think that they get number one, really high quality care from our residents, and we provide a broad spectrum of care also. One of the areas we're very strong in is behavioral health. We have an integrated psychologist in our clinic. We have a special relationship with our behavioral health department where we can get complex care and consults with psychiatry. So that's been a really important thing. I also believe that our patients enjoy being part of a training program. If you don't enjoy that, then you're not going to last very long in our program because you are seeing trainees. But these trainees are really high quality people who have a tremendous desire to serve, to be involved in the community, and to make a difference even not only just in our clinic, but beyond clinic walls. I could give you examples, too, of just the heart and soul of so many of our residents who are reaching out into the community, who are doing wonderful things with opioids, who are doing, and trying to stem that epidemic, working with socioeconomic determinants of health, and trying to make a big difference in our community. So I think both on the individual patient level and at the community level, we're really reaching out.
Fantastic. All right. Okay. So, can you talk a little bit about how this program could reduce cost in recruiting family practice physicians?
The impact on reducing the cost of recruitment could be really substantial. It costs up to between $250,000 and $500,000 to recruit physicians. So to get a primary care doctor into our region is not as easy as you might think. You have to remember we're competing against all the major metropolitan areas, not only in the state, but in the region. So from Minneapolis, Chicago, Milwaukee, and Madison. So we have to stand out from those major metropolitan areas. And to be honest, that's where most of the medical schools are. Most of the people are coming from bigger cities. So we provide an opportunity for trainees to come experience Gunderson and hopefully stay. Our first class, 3 out of the 4 residents are actually staying in the Gunderson system. So if you extrapolate that cost, that's about $1 million in cost savings. The other issue I would say is I'm very glad when our residents stay at Gunderson. However, our major goal is to train physicians who will help ease the manpower shortage in rural Wisconsin, rural north northeastern Iowa and southwestern Minnesota. So that's our major goal. Our other resident physician is going to Rice Lake, Wisconsin to practice in a rural practice, and that's just a phenomenal thing. So first of all, there's just that recruitment. We also are a rural residency. Our residents spend now 3 months a year, 3 months during their residency in rural practices. So they go to all of our Gunderson affiliates, including West Union, now Decorah, Viroqua, Boscobel, hopefully Hillsborough, Toma, Whitehall. All of our residents spend time there. And if they happen to fall in love with a place like that, hopefully we're going to start filling some of our regional affiliates also. So that would be a byproduct of getting our residents really great rural experiences. Okay?
Very good. All right. Can you talk about recruiting and selecting the best of the best, those that are trained in the Gunderson method and prepared to work at Gunderson right away?
The question is how are we recruiting? And there are 3,000 applicants for resident spots in the country, and we get about 1,000 applications for our residency that come online in September for the following year. So we have to decide how we're going to choose among those 1,000 applicants. It's been relatively easy. The first thing I'd say is we have the WARM program, the Wisconsin Academy of Rural Medicine, and we've been a really popular site here. We have 12 or a few more students, depending on the year, who do the last 2.5 years of their training at Gunderson. Most of them really love Gunderson Health System, and many of them have chosen to stay. So that's a very nice pipeline of high-quality people. They're people who've been trained at Gunderson, have an idea of a totally integrated healthcare system that's high quality, and many of them want to stay. I can't do the quick math, but each year we've had a number of WARM students. I believe at least 2 WARM students in each of our class, and some of them have actually come from the Gunderson program. There are WARM programs in Green Bay and also in Marshfield. So those WARM students get an exposure to us during their other educational opportunities in the WARM program. So that's been a very important thing for us. We also have so many med students who do much of their training from UW-Madison, and they come here and love the training they get at Gunderson. And if they choose family medicine, they're really thinking, boy, I loved it there. That would be my experience when I did my pediatric rotation here. I said, boy, if I ever come back to Wisconsin, I'm gonna work at Gunderson. So they get that opportunity to be med students, both in pediatrics, obstetrics, internal medicine, or some of the subspecialties. So they know about us, and we have a very good reputation. UW-Madison puts out about 30 med students a year, and we interview most of them who at least want to come and look at us. And we do offer, some people want a urban program. Well, they're not going to find that here. But people who want a really high quality rural experience will be drawn to us. We're also trying to break into the really high quality students at the University of Minnesota, and then the DO candidates, for instance, in Des Moines and in Kirksville. And we're interviewing more and more. We actually have 2 DO residents now, both of them from Waukon, where there's obviously a Gunderson affiliate. So we're really excited to have them. So that's the way we've been able to attract really high quality residents. We have a real bias for people who have a connection to the Midwest. So that's almost the first screen we put on. It's like, are you likely to end up in the Midwest? There was a Graham Center study that looked at what if you get a resident who's from Wisconsin and trains in Wisconsin, there's a very high probability they're going to work in Wisconsin. So that's one of the reasons we really select people who have a Midwest tie, not just Wisconsin, but we look at that The Medical College of Wisconsin puts out very high candidates, and we get a number of their applicants. And the rural medical schools that the Medical College of Wisconsin has produced in the last 3 years are starting to fill our residencies too. So we interview a number of those candidates every year.
Great.
Okay.
Very good. You touched on the thing, looking at that Midwest tie, where they come from, and what their background is.
Yeah, we really focus on that. If I get a candidate from Miami and they have no tie to Wisconsin, I won't even interview them, even if they're the best thing in the world. I will say, and it's very nice to see, when we see people who went to UWL or Viterbo and then went on, those connections to lacrosse really are nice. When people come here and experience a winter like we've had this year, and you're not from the area, I think many of them are going, what's the next airline flight out of here? You have to enjoy and embrace the winter here in Wisconsin for sure.
Do you think that matters to patients if they find out that their provider also has that local connection?
Oh yeah, I think patients love it. If you say, "Oh, I'm from Waukon," or "I'm from Wisconsin," because there's always that banter going back and forth with, "Where are you from, doctor?" "Oh yeah, I'm from Wausau," or "I'm from Rhinelander," and it helps. And then when we really see people, when we see medical students who are actually from Stoddard, were born and raised in La Crosse, people love that. I think they also think this person may stay here, which is very nice. Yeah.
Great. Okay. So what is it that you're most excited about when you think about the future of the program?
I have so many things that I'm excited about as we go forward. I think it's just going to be fun to have graduates and watch what they do. So having graduates who go out and do rural family medicine will be very exciting to me. So this will be the first year we actually get to watch the fruits of our labor, if you will. So watching them and hearing about the great things that they're going to do. I think we're always looking to be better every year. If you look at our curriculum this year compared to 3 years ago, we've made so many changes. So it's just a passion for improvement. So our residents, particularly the first class, they've had to struggle with some of the things we've had to change, which has been great. They've known they've had to be pioneers of sorts. I think they've had a great experience, but they've also had to help us become better all along. So just becoming really one of the premier residencies in the Midwest is really what I get excited about. I think we're always looking to be better in many ways. We're writing grants. We're improving our experiences for residents, for instance, in addiction care and a complex psychiatric care, because that's such a shortage in our state. And then watching how I also get very excited when I hear just the comments of attendings for our residents saying, "Where do you get such great residents?" And I go, I guess it's Gunderson, the environment we're providing. But that's also very exciting as I watch the residents and how they perform out on the wards. Gunderson is a very complex medical center that receives very many sick patients. So watching our residents go out and do very well in this complex environment gives me a great deal of satisfaction.
Very good. So can you talk a little bit about why Gunderson and Gunderson's leaders chose to make an investment in this program to start with?
Yeah, our leadership, when they approached me in 2013, I believe that they'd been thinking for a while about family medicine and bringing a residency here. We have a very high quality internal medicine program. for sure, and a general surgery program that's very high quality, and a transitional residency program. But I think it was several issues. First, and maybe the most important, was I really feel like Gunderson felt like they should be contributing to the production of rural family physicians in the region, not just necessarily Gunderson spots, but it was like, we have this great opportunity to produce residents who are going to fill our state and fill our region. So we should do that. It was just a really philosophically important decision that they felt they should do that. They knew that it would be very expensive. Producing family medicine residents is a very expensive endeavor. There are so many issues regarding federal funding of residencies that's really too hard to get into for this. Just to say that Gunderson was going to have to foot all of the cost, and that there was going to be no further federal monies coming to help us as we expanded to 18 residents. I think also Gunderson realized, when you look at our map, that we have, I believe now, 33 rural clinics and numerous critical access hospitals, and the number of open physician spots in our system is pretty substantial. It's also true that it's very hard to recruit a rural family physician. And in fact, recruiters will say that the hardest position to fill in the country is a rural family physician who does obstetrics. About maybe 1 in 100 residents is looking to do that. So by creating our own residents, we're going to help fill our own spots. So I think that they were also looking at a manpower shortage and a possible pipeline for physicians to come into our area. I also believe that physicians in these rural areas feel the benefit of training. It's a win-win when you bring residents, and the vibrancy and the curiosity and the work ethic of residents into a rural clinic. It adds life. And so that's a win-win also. Okay, I don't know
Great.
what else to
Yeah,
say.
no, that's great. That's fantastic. All right. We've talked a little bit about the focus of this complex psychiatric care and the integration of behavioral health into the residency clinic and the practice and training of the residents. Can you speak about the intention of doing that, and why this has been selected very intentionally to be incorporated into the clinic and the practice and the training of our residents?
Yeah, the question is really why were we so intentional about behavioral health training in our residents? I think that probably the answer is looking at what family medicine does. We need to provide a broad spectrum, but what we find is that about 40% of all patient care is tied up in behavioral health. And we also know that mental health, behavioral health disorders impact even medical illness in a real substantial way. The other thing is, about fully half the counties in our state have no psychiatry whatsoever. That means there's not a psychiatrist available. And these patients end up in our family physician offices. Our specialty, which is grounded in ambulatory care, ends up providing a huge amount of the behavioral health in our state. We have so much complex mental health, and by that I mean severe refractory depression, bipolar illness, psychosis, other things, addiction. All of those things are things that really have to fall on our primary care workforce. And so we need to train that workforce for that. The other thing that really happens when we integrated behavioral health is that our residents really have to learn to work in a team. You cannot provide medicine alone anymore. The idea of a single physician who sees everyone and takes care of everyone all by himself or herself just doesn't happen anymore. So we need to learn to work in teams, both in the hospital, in our office. And offices haven't traditionally been team focused, and that was really something we really wanted to focus on. How do you become part of a care team? And psychology, psychiatry are really involved in that training as we teach our residents how to lead 21st century teams wherever they're going to end up practicing.
Great. Okay, so Kirk, are you feeling good about our content here?
Mm-hmm.
Okay.
I think we got more than enough
Yep,
already.
yep, I'm feeling great too. So the last question I'd like to, topic I'd like to discuss is the integration of philanthropy and this philanthropic investment in a program that, as you mentioned already, Gunderson has footed the bill to ensure that this endeavor was possible. And so can you talk a little bit about the philanthropic investment of donors in our community in joining us and partnering with us in this endeavor together, and what you would say to them for their decision to do so?
The question is, why would I think to gather the heart of that question is, why would this be a worthwhile investment for someone who really wants to donate and support the medical training in our city? And first of all, I think the real obvious is how expensive it is. As I said, there's no federal support for our residents in family medicine, so it's all come from Gunderson. They realized when they did that there was a $3 million remodel of our space to make it a really great educational space. And then most of the faculty salary has to come from philanthropy. We're only seeing patients about 20 to 30% of our time where we can generate enough money, whereas 70% of our time we're really training young doctors, mostly in the clinic. They're seeing patients, we go into a room and see patients, but that doesn't come close to covering the cost of our training. So I think if the other thing that sets our residency apart is our outreach into the community, just training young physicians who are going to make a difference in population health, in how we can change all of the socioeconomic determinants of health, is something that is really worthwhile and is going to be a return on investment. So as we begin to tackle all of these issues, the cost of training, but I think if you're someone in this community who cares about this community, the return on investment for training these young doctors will be very, very substantial. So there's a high cost to what we do. The institution has chosen to support that cost, but now we're really looking for support just because of the amount of resources it takes to train a great family physician in all of the things they need to do. I'm not very good at that one.
No. I loved exactly how you put that at the end. Can you continue to talk more so on why Gunderson can't do it alone? You know, that you talked about as a new physician leading teams in that this has shifted. This model also applies to a broader scope in terms of partnership and teamwork in addressing this challenge for our region, shortage of family care, right? So we look together to partner on how we can address that, and how philanthropy and our donors are our partners in that.
Oh, sorry,
Yeah.
I'm kind of not understanding. Okay. So what would say that again so I can really apply?
So just as you talked about the physicians needing to lead teams in order to provide the best care now in the 21st century, when Gunderson looks at its business model or its structure and looking at all of the costs and all of the needs, and then of course making wise business decisions to help address those needs, that healthcare as Gunderson as an entity can't possibly address everything we need for our community alone without the help of our community or others to partner with us to address that. And philanthropy and our donors who are partnering with us are helping us to address those great needs for our region.
Yeah, I think really the heart of your question is, why do we need to have philanthropy for the education of these young physicians who are really going to be extraordinarily trained to make our region and our city better? I think, first of all, there's just the expense of training these physicians. All of the things that they're required to do in the training process is very labor extensive. They really have to be taught by an apprentice model. It's really one-on-one, one-on-two much of the time. So that's one of the reasons that it's just costly. The second, I think, gets back to just the what's happening in healthcare. It's no surprise to people that margins in all major hospital systems are diminishing. The amount of money for things that are really important to us, including education, seems to be tighter. So we're left with this really important mission of training young doctors in a time in which the federal government and other places are actually withdrawing support for the care of patients, really cutting back in substantial ways in the amount of money that they'll even give to for us to provide medical care. And that really leaves educational programs, I would say, vulnerable to shortages in money. So how do we make that up? Really, it has to come from the communities that benefit from these young physicians who are going to move forward and help care for communities both in La Crosse, but also these rural communities around us. As far as we go into Iowa, Minnesota, and into west and central Wisconsin, these communities are really dependent upon us to produce physicians. Without these rural family physicians, these little rural important community critical access hospitals really struggle. They need a family physician to help see patients. That's what drives these hospitals. So these communities need this pipeline of physicians to do that. And so we are just looking not for everything to cover the cost, but we need that help.
Great, fantastic.
No.
No, you did it great. Now, if I were a donor who had given support to the program specifically to invest in this, what would you want to say to that person?
I would want to tell you, if you have contributed or are thinking about contributing to our family medicine residency, that this would be just such a worthwhile investment. I think you could look at really the dream and the vision and say, oh yeah, I can get behind that. Because really the dream to make rurally leaning, high quality family physicians on itself is just so inspiring because communities need this. However, then I'd look at what we're doing and saying, is the money people have invested being worthwhile? And there's no doubt in my mind, 3 out of 4 of our residents are staying with Gunderson. They're going to go out into these communities. We are making residents who are really high quality. I could brag forever about their board scores and what they're doing and the research they're doing and their care they're giving our patients. But that's the one thing I'd say, the return on investment already is so strong, and we're only in our 3rd year of producing residents. So this would be something I think you could come and say, I donated to that and they're doing this. Wow, that's pretty cool.
could you say, thank you to all of the benefactors who have supported this endeavor or partnered with us in this program, and in your own words, just somehow say, thank you to those who have joined and partnered with us to make this possible, and I look forward to continuing that partnership in the future, or something about thank you for now and the future is bright.
Sure. This is such an easy thing for me to say because so many people have stood with us already, so many benefactors. I really want to make the family medicine residency clinic a great team-based clinic. I really want to help support the salaries and the programs that the family medicine residency has done already. Without your support, whether it's foundations or people, we couldn't be halfway to where we are. So I want to say thank you so much for doing that for us. We also just look forward to the future. The more support we get as a health system for philanthropy, for our educational programs, the more it frees us up to be innovative and to expand the training programs that we have, bringing in the highest quality residents and also getting the highest quality faculty so we can train those residents. So thank you so much for what you've done in the past, and we really look forward to more and more partnerships with the community, small rural communities, and other people who would benefit from the work that we're trying to do.
Great. Perfect. All right. I think we have it.
Mm-hmm.
Oh boy.
All
Like I said,
right.
you can't dress a pig.
Oh, you did great.
You did fantastic.